Security and Civil Defense Corps in Benue has paraded a 17-year-old female identified as Ugoma Okoye for allegedly killing her 3-year-old stepson, Van Okoye, in Gende village, that's in Goma local government area of the state. Parading the suspect at the command headquarters in Makurdi, the state commandant, Larai Beatrice, stated that the suspect was arrested on the 12th of September for a case of culpable homicide. Mayowa Kwanto reports.
State commandant narrates how the command received the distress call from members of the public about Mrs. Ngwemo, who had allegedly murdered a 3-year-old boy and dumped his corpse in a river at Ginde village in Goma local government area.
Nigerian Security and Civil Defense Corps, Benue State Command, is parading the suspects by name Ikoye Egumo, age 17 years old, a female, of a case suspected of a case of culpable homicide. She was arrested at Ginde village, Goma local government area of Benue State on the 12th of September, following a distress call by members of the public that one Ikoye Egumo had murdered a 3-year-old boy by name Ikoye Vanen, her stepchild, and dumped his body in the river. The command will do due diligence and at the end of the day investigate the suspect and will be handed over to the police.
While answering questions from the media, the suspect explains she is the victim's husband's second wife. She narrated incoherent escapades into the dastardly act.
What happened? That they went firewood hunting with the child. The thing came like a spirit upon her. Entered in her and then she did the act she did. The child is 2 years and...
The command appeals that life is sacrosanct and no one is permitted to take another's life, no matter the level of provocation. Mayowa Okwanto, TVC News, Makurdi.
The Federal Road Safety Corps Kano State Command has confirmed the death of 5 police officers in a fatal road crash while returning from Edo State, where the governorship election was recently held. In a statement issued by FRSA spokesperson Abdullahi Labaran, it was also confirmed that 10 other individuals sustained injuries in the crash. The incident occurred on the Kano Zaria Road near Kosofe village. Preliminary investigations by the FRSC revealed that the accident was caused by excessive speeding, which resulted in the driver losing control of the bus and crashing into a stationary trailer. The FRSC Sector Commander Ahmed Mohammed cautioned drivers against the dangers of excessive speeding, overloading, and other traffic violations. Ibrahim Isa joins me live from Kano. What more updates and details do you have on this story, Ibrahim?
Well, it's a very especially for the Nigerian police force. The number of those who lost their lives still remains, those injured remain 10. There to see any statement that is as addressed, but of course, families of those affected are already in a state of mourning. And the location where this incident has concentrated people.
We'll get back to Ibrahim subsequently for more details on that story. The Lagos Task Force says they will sustain their operation in the state. The assurance is coming after the agency carried out 2 separate operations between 3 and 4 p.m. respectively on Tuesday at Oshodi, Bolade, and its environs. The Director of Press and Public Affairs, Badiyo Abdurrahim, in a statement said the chairman of the agency, CSP Adetayo Akirile, said operations were executed following complaints by motorists, residents, and others through the agency's feedback channels. They had complained about rise in criminal activities, particularly during rush hour. According to him, the agency cannot allow criminal elements to hold people hostage in the state. All those arrested says will be prosecuted accordingly. Still ahead on the news tonight, Petroleum and Natural Gas Senior Staff Association of Nigeria wants federal government to review economic policies. We have that story and more shortly. You're watching Beyond 100 Days with Nifemi Oguntoye. President Tinubu, since he assumed office,
we are on our way to progress.
6 out of the 8 APC federal lawmakers
have a movement structure that's going to take back our party in Enugu State. Because this one I'm seeing is tales by moonlight. It's not working.
So I'm wondering what you think, or who you think can stop him now.
He doesn't own the party.
One of the causes of inflation is because people cannot go to the farm.
The government still needs to do more so that people can eat.
I believe what we're clamoring for is more responsible use of social media. Not that people just go in there and think that they can say anything to anybody.
The Petroleum and Natural Gas Senior Staff Association of Nigeria, PENGASIN, has attributed the hike in petrol and scarcity of products to the floating of the naira. The senior oil workers made their position known at a press briefing in Lagos. At the briefing, President PENGASIN, Festus Osifo, released a communique following completion of the 3rd edition of the Energy and Labour Summit of the Union. The communique highlighted solutions to various challenges facing the oil sector, which include crude oil theft, the need for amendment of the Petroleum Industrial Act, application of artificial intelligence in the oil and gas industry, the need for actualization of the Nigeria Gas Master Plan, among others.
From September, October last year, government was paying fuel subsidy. So if you are paying fuel subsidy, how was the governors getting more money? It wasn't from subsidy. It was from devaluation. That is why you see FROIS declaring more naira. That they have made trillions of naira within a little time. That is why you are seeing customs telling us that they are making more money. It is because of devaluation and exchange rate. And where does this money go? Majority of this money goes into the federation account that they are going to share. In fact, that is why they have more naira to share. It is not because the proceeds from subsidy. That narrative, almost all the pressmen, whenever I listen to them, I said, no, let's do a little more digging. We shouldn't just take narrative from government and run away with it.
The United Nations Children's Fund, UNICEF, and the Borno State Primary Healthcare Development Board have launched a comprehensive vaccination campaign across all IDP camps in Maiduguri. And this is a proactive measure to prevent the outbreak of diseases, especially cholera and measles. TVC News senior reporter Jesse Tafida has more.
For weeks now, thousands of people have been taking refuge in camps after waters from Alo Dam washed away houses, hospitals, markets and schools in Maiduguri. Due to the severity of the situation, most IDP camps are overcrowded with little access to healthcare services. Today, the United Nations Children's Fund and the Borno State Primary Healthcare Development Board is launching a campaign to sensitize and vaccinate children. The team will also provide essential supplement to boost their immunity.
From January 2024 till date, Borno State witnessed 36 suspected cases of cholera, acute watery diarrhea. Out of this, including during this flood, only 4 cases were sent to the National Reference Laboratory, which is run by NCDC in Abuja. And out of these 4, only 2 turned out to be positive. And these 2 have already been discharged home. We have taken measures, immediate measures, to ensure that these people were treated as suspicious cases of cholera. So we have already established all the rules and regulations and the hospitals where, if necessary, these cases are referred to and treated appropriately.
We are very relieved that we have received a portion of the very scarce cholera vaccines. There are only very few available globally, that we have received 500,000 doses for Borno State, and today the first children and the first mothers and the first health workers are receiving this vaccine to prevent the outbreak of cholera.
In addition to addressing public health issues, the government and UNICEF seek to guarantee safety of those taking refuge in camps across the state. They assured that the vaccines are safe and have been tested and approved. Jessie Tafida, TVC News, Maiduguri.
Nigerians have been counseled on the need to place premium on their eye care by visiting their ophthalmologist from time to time. This advice was given at the recent free eye screening and surgery outreach organized by a member of the House of Representatives, Kafila Togbara. We have details in this next report, and we'll return with business news.
People have been advised to always stick to the doctor's drug prescriptions, especially in relations to eye care. An optometrist gave this advice during the flag-off of one-week cataract surgical operation organized by a member representing Kosofe Federal Constituency in Lagos State. According to the lawmaker, the gesture was part of our efforts at giving back to our constituency, as well as making sure that Kosofe residents have a healthy eyesight.
A free eye screening, not just the screening. We are doing, we are giving them free medication. We are also doing free eyeglasses.
When you look at it today, cataract surgery alone is about 250,000 right now in Nigeria. So how many of these people can afford such things? So for them to bring this particular program, it is a very, very remarkable thing.
While commending the federal lawmaker for our effort, founder of the Eye Foundation said the intervention is timely.
With the economic situation of the country today, how many people, especially among the downtrodden, can freely go to the hospital and get his eyes checked and, if possible, operation?
This is really, really nice. This is giving a lease of life, a new lease of life to the constituents. Because if you give somebody an opportunity to see, then you are giving the person a new lease of life.
Patients and beneficiaries appreciate the concern demonstrated by the lawmaker and Eye Care Foundation.
It's a very laudable program, and God will help her. God will help her to do more, and God will bless her.
On the sideline, the residents are also advised on how to take care of their health and the government property.
A lot of our citizens, sometimes they are not playing their role. When they put drainages, the iron there, people remove them to sell them. And, these things should stop.
The message here is clear. Beyond this intervention, medical professionals are advising citizens to give utmost care to their eyes.